Hello everyone, this is Patrick Jagir with LifeSpring and the LifeSpring YouTube channel. I want to talk to you about the hips. So, the hips are a very stable, very strong joint. They take a lot of strain and they accumulate a lot of tension. In a lot of ways they're like the shoulders. So, first exercise I want to take you through. We'll start basic, we'll get a little more advanced as we go. Now, to do this one, get about a shoulder width stance. I like it a little wider, somewhere in there. You see what's comfortable, see what works for you. And then I like to put my hands on my hips. What we're going to do, we're going to work through 4 cardinal points. So, we've got our north, south, east, west. So, take a second, go between these. So north, south, east, west. Pretty straightforward. Now we're going to do something different. Something you haven't really moved like this since you were a little kid, most likely. Some people know. Dancers, they do a lot of different types of movement, but they're an exception. So, you can start anywhere in the cycle. So, you can start north. So engage your glutes, pelvis forward. So we're at our north. Bring it around east. So your legs stay straight. Your hip pushes out. And then south, west. Again, legs straight. Push that hip out. Back to north. Hip out to east. Hips back to south. Hips to the side to west. Remember, very little angle in the knees. Pretty much straight. Not locked, but straight. And then again, back to north. So let's just do it fluid. Let's just go through all these points. So you'll very likely be feeling a little tension in different parts of your hip. Hip flexors, adductors on the inside of the thighs. You may even feel your IT bands on this one. That's all healthy and normal. We give those muscles a nice gentle stretch, and it's going to make some space inside the hip joint capsule. Go the other way. Show you another angle. So bring it around town. If you haven't done this in years, you may never have moved like this. So you may hear some snap, crackle, pop. I did when I first started practicing this. But I got through it and I'm all the better for it. So no big deal. Work through it. Again, if you have any severe pain, any severe stabbing, wincing pain, go get checked out. Otherwise, work through that soreness. Work through that snap, crackle, pop. Okay, so that's the easy one. Let's take it a step harder, a step more challenging. So this one's kind of like when you used to play with the hula hoop when you were a kid. So for this one, I want to put a little bend in the knees, and we're going to replicate that motion that you use to keep that hula hoop on your waist. So this movement is also circular, and it has 4 cardinal points, like a compass. So you pull your pelvis in, you get your north, flare your butt back, get your south, and to the right, you get your east, and to the left, get your west. North, south, east, west. North, south, east, west. When you first start doing this, to warm yourself up for the circular movement, just go through those cardinal points, your north, south, east, west. Get your muscles warmed up, get your nervous system ready to do it, and you'll get a better circular range of motion. So now for the circular range of motion, go through those 4 cardinal points. But instead of going through center, go through the outside. Go around the circle. Bring it around town. When I first started doing this, my hip used to crack every time. It doesn't do it anymore. It feels a lot better. I've come a long way with this one. Another thing that this does for you is it mobilizes your lower back. Because in every rep, you're going between here and here. So this whole lumbar spine is articulating, bending in both ways, arching and flexing. So for balance, go in both directions. Alright, that's the hula hoop. Let me give you one more exercise. This is another circular movement for the hip. So what you want to do is put all your weight on one leg. And you're basically going to balance on that leg. Now when you're starting out, you want to put your hand on something to balance. That's totally cool. I highly recommend it. Stabilize yourself and get a good range of motion. Get a good scour of that hip joint. Because what we're going to do, we're going to move this hip in a wide circle. We're going to break down adhesions in there. We're going to break down mineral deposits and adhesions in the connective tissue and all that good stuff. So, what you're going to do is move that knee in the widest circle you can. So you're moving that femur, that thigh bone, in the widest circle possible. So you bring it across your center line, up, back across the center line, and out. Make sure in your posted leg and the leg where your weight is resting, make sure there's some bend in that knee because you can get more range of motion. Typically what we do in America, in the Western world generally, we do sort of our beach body pose. So we're showing off, men and women, we're showing off our chest and our glutes. We got everything flared out and we're kind of walking around like this. Problem with that, you can show off your pecs and your glutes and all that, but you divide your body. You put a break right in your midsection, so your upper body is not connected to your lower. So, an example of this is I can't get my knees very high when I have this arch in my lumbar spine. A lot of different things do this. People do squats. They reinforce the spine shape. They got that bar in their shoulders. High heels do this to women or men that wear them too. 2017, no big deal, whatever you want to do. But the heels definitely reinforce that spine shape. So we want to get back to more neutral. We want to let that lumbar spine hang more. So, when you've got that spine like that, you can't bring your knee very high. Your body's very disconnected. Now, when you bend your knees, tuck your pelvis a little bit, let your spine hang, let your back be flat, your knees come up a lot higher. So work that into this exercise. So on that leg where you're putting your weight, put some bend into that knee. And get a good, nice big circle in there. And then go the other way. So knee out, cross, back down. Do the other side. So, bend in that weight-bearing leg. Take the working leg, bring it across your center line, bring it up and back out. Go the other way, point the leg out, bring it up, cross the center line, back down. Alright, that's it for today. I've got a lot more on the hip, but I don't want to overload you on the first video. So stay tuned, I've got more coming.